Today in this lecture, we are going to discuss the importance of hydrostatic pressure and colloid osmotic pressure in the renal interstitium. Previously, we have discussed in detail the importance of hydrostatic pressure and colloid osmotic pressure in the reabsorption of fluid into the peritubular capillaries. Now, we will discuss importance of hydrostatic pressure and colloid osmotic pressure in the renal interstitium and their importance in reabsorption of fluid in the peritubular capillaries. So before discussing the details, we will quickly revise and summarize how the fluid reabsorption is occurring in the nephrons in the kidneys, although we have discussed it and revised it many times. So inside the kidney, we have nephrons, and the nephrons have tubule in which filtration of fluid occurs. Here in the glomerulus, fluid moves through the tubule like this, and while fluid is moving in the tubules, there is some reabsorption of fluid from these tubules, these green, brown, blue color tubules, into the capillaries that are present around these areas. So the fluid that moves into those capillaries, those blood vessels, that will go back into the blood, while the remaining fluid will go through these tubules and will ultimately go out of the body. Now, if we look at this area in detail, this look like this diagram. Here is the blood vessel coming. Here is the filtration process in the glomerulus. Fluid enters through the Bowman's capsule into the renal tubule, and while the fluid is moving, there is reabsorption of some fluid from the renal nephron tubule into the peritubular capillaries. But this reabsorption of fluid from the nephron tubule into the peritubular capillaries is through this renal interstitium, and there are forces: hydrostatic pressure and colloid osmotic pressure in the peritubular capillaries, and there are forces, the hydrostatic pressure and colloid osmotic pressure in the renal interstitium. We have discussed those forces which are present in the peritubular capillaries in our previous lecture, but in this lecture we are going to focus on the hydrostatic and colloid osmotic pressure present in the renal interstitium. So this is the nephron tubule. These are the cells of the nephron tubule. So these cells are cells of this area, the cells of the nephron tubule. This area is showing the renal interstitium, and here we have the renal interstitium, and here is the capillary, the peritubular capillary, and this one is the peritubular capillaries. So now, going into detail, there are hydrostatic pressure. There is hydrostatic pressure in the interstitium, which is opposing the fluid, which this fluid is favoring the reabsorption of fluid from the interstitium into the peritubular capillary, and there is hydrostatic pressure in the peritubular capillary, and this is opposing the fluid. This hydrostatic pressure is favoring the reabsorption process. This is favoring the reabsorption process in the peritubular capillary, while this hydrostatic pressure in the peritubular capillary is opposing the reabsorption from the interstitium. Similarly, we have the colloid osmotic pressure due to proteins in the blood capillary and the peritubular capillary, and this force is favoring the reabsorption process. Here, there is 32 millimeter of mercury force, which is helping in the reabsorption of fluid from the interstitium. Similarly, we have the colloid osmotic pressure or the oncotic pressure in the interstitium, which is opposing the reabsorption of fluid from the renal interstitium into the peritubular capillary. Now, any factor which will increase this force, the hydrostatic pressure, it will basically decrease the reabsorption process in the peritubular capillary. Any factor which increases this force, the colloid osmotic pressure, it will help in the reabsorption of fluid from the interstitium into the peritubular capillary. But this will be with the help of the hydrostatic pressure and colloid osmotic pressure in the renal interstitium. So initially, when there is increase in hydrostatic pressure in the peritubular capillary, this increase in hydrostatic pressure, it starts opposing the reabsorption of fluid from the interstitium. When the force, the fluid absorption from the interstitium decreases, there is decrease of reabsorption from the nephron tubule. When pressure in this area increases, it opposes the reabsorption of fluid from the interstitium, which ultimately decreases the reabsorption from the tubule. So in a way, the reabsorption process is closely matching. The reabsorption into the peritubular capillary is closely matching with the reabsorption of fluid from the nephron tubule. So the amount of fluid that is reabsorbed from the nephron tubule is closely matched with the amount of fluid that is reabsorbed into the peritubular capillary. If any force increases or decreases, the forces in the renal interstitium also increases or decreases, due to which the reabsorption of fluid from the nephron tubule also increases and decreases. But the purpose of the lecture is to discuss that before any change in reabsorption from the nephron tubule occurs, there must be some increase or decrease in the hydrostatic pressure or the colloid osmotic pressure in the renal interstitium. Suppose, for example, the colloid osmotic pressure in the peritubular capillary increases. This will pull the fluid from the renal interstitium into the peritubular capillary. When the fluid will move into the peritubular capillary, the proteins in this area will become concentrated. When the proteins become concentrated, the colloid osmotic pressure in this area also increases. This will pull more fluid from the nephron tubule through the cells through these areas into the renal interstitium. So any increase or decrease in these pressure, the hydrostatic pressure or colloid osmotic pressure, first of all influence the colloid osmotic pressure and the hydrostatic pressure in the renal interstitium before affecting the reabsorption from the nephron tubule. So the summary of the lecture or the importance of the lecture is that before any influence of hydrostatic pressure or colloid osmotic pressure on the in the peritubular capillary can occur on the fluid absorption from the nephron tubule, it will have to show up in the renal interstitium, and any change in the hydrostatic pressure in the renal interstitium or colloid osmotic pressure in the renal interstitium will reflect by increasing or decreasing reabsorption from the nephron tubule. Thanks a lot for watching the video.